Welcome back guys. Now in this video let's discuss about the topic of regulation of respiration. Okay. Now my first question to you, your respiration, is it under your control for most of the time? Is it under your control? No. It's happening, inspiration, expiration, it's happening on its own. So someone is regulating. So of course you can control it. You can do inspiration, you can do expiration, but you are not doing it voluntarily, right? Most of the time. It is happening on its own. So there are certain centers, okay, there are certain centers which are regulating your respiration, okay, involuntarily, okay, so that it's happening. So what are those centers? See, you know, here is a pons, here is a medulla, here is a spinal cord. There are two pontine centers and three medullary centers. There are two centers in the pons and three centers in the medulla. They are regulating your normal respiration. So what are they? What is the name of two pontine centers? The name of the two pontine centers are, first one is called as, you can remember it like a PA, pneumotaxic center. Second one, apneustic center. Apneustic center. So in the upper pons, UP stands for upper pons and LP stands for the lower pons. So always it's like a PEA. So pneumotaxic center and apneustic center. Next, what are the three medullary centers? Three centers in the medulla. The three medullary centers include the dorsal respiratory group DRG, ventral respiratory group and pre-Bodzinger complex. Okay, pre-Bodzinger complex, which is the pacemaker of the respiration. So dorsal respiratory group, ventral respiratory group and the pre-Bodzinger complex, which is considered as a pacemaker. Okay, it's a pacemaker of respiration. We all know who is the pacemaker of the heart. It's the SA node. So our heart activity is under the control of the SA node. In the same way, who is the pacemaker of the respiration? It's the pre-Bodzinger complex, which is present in the medulla. So try to understand, if there is any damage to the pre-Bodzinger complex in the medulla, do you think you can do the respiration? No, you can't do the respiration. Okay, so that's why in hanging, okay, whenever there is a judicial hanging, whenever a person has undergone hanging, so what will happen? Why there is a death in hanging? So whenever a person hanged, you know, there is damage because of that hanging. Okay, the vertebra, we all know there is something called as a atlas, axis vertebrae. First vertebra is atlas, second vertebra is axis vertebrae. So this axis vertebrae is going to have this odontoid process. When a person is undergoing hanging, this axis vertebra, okay, this odontoid process of this axis vertebra, it's going to break, it will come and compress the pre-Bodzinger complex. So the pre-Bodzinger complex will be affected. So whenever the pre-Bodzinger complex is affected, so do you think the person can breathe? No, the person cannot breathe. So this is the must and should one. It's a pacemaker for the respiration. Whenever it's not there, the respiration cannot happen and the person will die. So now tell me, in a patient who is undergoing hanging or who has undergone hanging, the person is dead. What is the cause of death? It's asphyxial death. The person cannot breathe. Okay. So always remember, pre-Bodzinger complex, pacemaker. There are certain drugs which can inhibit this pacemaker, so that there will be respiratory depression. What are those drugs? Opioids. We all know morphine, codeine. Okay. So opioid group of drugs. These are painkillers. We all know opioids. What they will do? They will inhibit pre-Bodzinger complex. They can inhibit the pre-Bodzinger complex. So what is the side effect of these drugs? Overdose of these drugs can lead to respiratory depression. Okay, respiratory depression. Next, guys, we all know in medulla, okay, there is pre-Bodzinger complex, pre-Bodzinger complex, and it's a pacemaker. Okay, then what about the pontine centers? See, the pontine centers are mainly helpful in regulating the respiration. Okay, regulation of respiration. Regulation of the respiration. Pre-Bodzinger complex is the pacemaker, we all know. And what about the pontine centers? We are having two pontine centers, right? What are the two pontine centers? Guys, the two pontine centers include pneumotaxic center and apneustic center. What they are doing? They are regulating the respiration, sir. What does I mean by the word regulation? Let me ask you something. See, you try to take first tidal volume. I have taken the tidal volume, see. I have taken the tidal volume. But if I wish, can I take extra air into my lungs? Yes. See, I am prolonging my inspiration. If I wish, I can prolong my inspiration. I can take extra air into my lungs. So that prolonging of inspiration is done with the help of which center? Apneustic center. So Apneustic center helps in, it's like an accelerator guys, it's like an accelerator. It prolongs or increases the depth of inspiration. It increases the depth of inspiration. It's like an accelerator. It increases your tidal volume. After tidal volume, inspiratory reservoir volume. It increases your depth of inspiration. You can take more air into the lungs. Next, I am asking you, try to take tidal volume. Tidal volume. Next, inspiratory reservoir volume. Means I have prolonged. But there is a point at which my inspiration is stopping. Okay, at certain point you are stopping your inspiration, right? Otherwise your lungs will rupture, your alveolus will rupture. So, who is the brake? You know the accelerator is the apneustic center. It can prolong the inspiration, but who is the brake? Who is stopping it? It is the pneumotaxic center. So, pneumotaxic center, it will limit inspiration, or it will stop, the better word, it will stop inspiration. So, it's like a brake guys, it's like a brake. Okay. So, apneustic center is like an accelerator, pneumotaxic center is like a brake, it will stop. Okay. Not only that, pneumotaxic center also controls rate. Okay, rate of breathing. Okay, rate of breathing, how many times you are breathing. So, that also controlled by the pneumotaxic center. So, these 2 points which I wanted to know. Okay. Next, what about the dorsal respiratory group and the ventral respiratory group? See, the dorsal respiratory group, it's going to mainly help in smooth rise in tidal volume. This is the MCQ. It's going to help in smooth rise in tidal volume. What does I mean by? See, it's not just starting is important. You have to maintain it for a certain time. So, first imagine my pre-Boltzinger complex is a pacemaker. It starts the inspiration, start. So, diaphragm is going to contract. So, you have to take the inspiration, right? 10 ml, 20, 50, 100, 200, 300, 400, 500. Till you get 500 ml of air, you should have your inspiration. Okay, you should have your inspiration. So, there is a slow rise in tidal volume. So, it's just not starting is important. You have to maintain it till you get 500 ml of air. So, who is helping in that process? See, it is the dorsal respiratory group. It's a dorsal respiratory group by producing something called as a ramp signals. Okay, these are nothing but the action potentials. By producing something called as a ramp signals, it helps in smooth rise in tidal volume. Okay, so tell me who is the initiator? Initiator is a pre-Boltzinger complex. Who will prolong? Apneustic center. Who is the brake? Pneumotaxic center. Who will help in the maintenance of the smooth rise in tidal volume? It's a pre-Boltzinger, it's a dorsal respiratory group. Dorsal respiratory group helps in smooth rise in tidal volume. So, try to understand. Starting, pre-Boltzinger complex. Smooth rise in tidal volume. It's a dorsal respiratory group. If you wish, you can take extra. That's a prolonging. Who will do that? It is the apneustic center. But at certain point of time, you have to stop. Who is that? Pneumotaxic center. Okay. So, these are all questions guys. Next, what about the ventral respiratory group? There is only one MCQ. See, usually for expiration, you don't require any center. Okay, you don't require any center for normal expiration. But if you want to do the forceful expiration by contracting your rectus abdominis muscles and transverse abdominis muscles, if you want to do the forceful expiration, then the VRG is going to be helpful. So, VRG needed only during the forceful expiration. Okay, it's only needed during the forceful expiration. Done. So, you know what are the Pontine centers? What are the 2 Pontine centers and 3 medullary centers? Now, what and all we have discussed, let's summarize. Okay, let's summarize. See, there are 3 phases: initiation, maintain, terminate. Start, maintain, stop. So, who is helping in initiation? You all know pre-Boltzinger complex, which is the pacemaker. It starts by activating the phrenic nerve. Okay, the phrenic nerve root value is C3, C4, C5. Now, once the phrenic nerve is activated, what the phrenic nerve will do? It is going to cause the contraction of the diaphragm, and the contraction of the diaphragm is going to start the inspiration. So, who is the initiator? Initiator is the pre-Boltzinger complex. With the help of the phrenic nerve, it causes the contraction of the diaphragm. Once the diaphragm started to contract, inspiration automatically happens. We all know. Next, what we have to do? We have to do maintenance. Okay, maintenance. For maintenance, what is the center required? The center is the dorsal respiratory group. So, who is going to activate this dorsal respiratory group? It is the apneustic center. Guys, remember, it's the apneustic center which activates the dorsal respiratory group. The dorsal respiratory group is going to produce something called as a ramp signals. Ramp signals, what they will do? They will help in smooth rise in tidal volume. So, how much ml of air is going to come into your lungs? 500 ml air. Smooth rise in tidal volume from 0, 10, 100, 200, 400, 500. So, smooth rise in tidal volume, it's always with the help of DRG, with the help of signals, ramp signals. Okay, now, my question to you, once you are having 500 ml of air, let's say, once you are having 500 ml of air, are you happy or not? Yes, we are happy. We got our tidal volume. So, we have to stop now. Now, question is, once you have 500 ml of air, Will your lungs stretch or not? Yes, because of the air inflow, your lungs are going to get stretched. Okay, your lungs are going to get stretched. Now the stretching of the lungs. So it's the lung stretch, guys. It's the lung stretch which is going to activate the vagus. So from your lung, the vagal afferents are going to take this information. Okay, vagal afferents. I am talking about the vagal sensory neurons. So from your lung, which nerve is going to start? The vagus nerve is going to start. The vagal afferents that I am talking about. So from the lung, it's a sensory vagus. It's taking the information to the brain. Okay, 500 ml came. We are satisfied. Lungs have stretched. 500 ml came. Now this vagal afferents, do you know what they will do? They are going straight forward, inhibiting. They are inhibiting apneustic center. So now tell me who is inhibited? Apneustic center inhibited. Once apneustic center is inhibited, what about the DRG? Dorsal respiratory group inhibited. No more RAM signals. So no more further rise in tidal volume. So what will happen? Inspiration stops. I have explained you, right? See, it's the apneustic center. It's the apneustic center and DRG. Both are required for the smooth rise in tidal volume, for the rise in tidal volume. But tell me, what is happening here? Once your lungs are stretched, vagus is activated. What vagus will do? Vagus is going to inhibit the apneustic center. DRG is inhibited. Without DRG, there is no ramp signal, no rise in tidal volume. So inspiration stop. Inspiration stops. So now tell me, this vagus now, is it acting like an accelerator or is it acting like a brake? It's like a brake. So already you know the pneumotaxic center is at brake number 1. Same pneumotaxic center also can inhibit. Pneumotaxic center also can inhibit. I have told you PA. Remember it like a PA. So P always inhibit A, guys. Pneumotaxic center always tries to inhibit the apneustic center. Now I am telling you there are 2 brakes. Brake number 1 is vagus. Brake number 2 is the pneumotaxic center. Both of them, they can inhibit the apneustic center. They can stop the inspiration. Who are the brakes? 2 brakes are there. 2 brakes are there. What are the 2 brakes? Vagus and pneumotaxic center. These are the 2 brakes. They are stopping the inspiration. Okay. Now, if you understand this, let me ask you some questions. Guys, imagine there is damage to vagus. Okay, bilateral vagotomy. Okay, bilateral vagotomy. Because of some reason, we have removed the vagus. Okay, there is damage to vagus. What do you think will happen to the respiration? We have removed the vagus, means brake gone. We have removed the brake. Whenever we have removed the brake, out of the 2 brakes, 1 is gone. What do you think will happen? Now the inspiration is going to be prolonged. It's going to be prolonged inspiration. Okay. There is going to be prolonged inspiration. Next step. Now I am talking about bilateral vagotomy. Both vagus are damaged. Okay, both the vagus bilateral, both the vagus damaged. Along with that, pneumotaxic center also damaged. Okay, pneumotaxic center also damaged. Both damaged. Vagus is gone as well as the pneumotaxic center is gone. Means 2 brake failure. Both the brakes are gone. Now what do you think will happen? Sir, whenever the brakes are there, whenever the pneumotaxic center and the vagus are working, inspiration is going to stop. Now do you think the inspiration is going to stop on time? No, inspiration is markedly prolonged. Now there is going to be markedly prolonged inspiration. Markedly prolonged inspiration. Okay. So this markedly prolonged inspiration, there is a name called as apneosis, also called as inspiratory spasms. Okay. So there is going to be markedly prolonged inspiration called as apneosis or inspiratory spasms. So they will ask you in your exam. See, this apneosis is going to be seen due to, the apneosis is going to be seen due to damage to both pneumotaxic center as well as the vagus. Both are gone. Okay. So how this apneosis is going to resemble like? This apneosis or inspiratory spasm resembles breath holding. Okay, they are going to resemble breath holding, as if the person is holding the breath. See, it's going to be prolonged, markedly prolonged inspiration. It looks like as if the person is trying to hold his breath. Next, what if there is a lesion above pons? Above pontine lesion means there is a lesion above the pons. What will happen? Let me tell you, students. See, question number 1. So, is your respiration under your control? For most of the time. No, it is happening on its own. So these are the involuntary centers. These 5 involuntary centers like the pre-Borsinger complex, pneumotaxic center, apneustic center, DRG, VRG, they are all doing the involuntary respiration. They are controlling the involuntary respiration. Question number 2. Can you control your inspiration, expiration voluntarily? Yes, we can do that. We can do that. So there are also voluntary centers. So above the pons, there are voluntary centers present. These voluntary centers also can control the diaphragm. These voluntary centers, they can also control the diaphragm. Okay. But right now, imagine whenever there is a lesion above the pons, here there is a cut, guys. Whenever there is a lesion above the pons, what do you think will happen? Now, whenever there is a cut over here, do you think these voluntary centers controls the diaphragm? They can control the phrenic nerve? No, cannot. So, whenever there is a lesion above the pons, there is no problem with these involuntary centers. These involuntary centers, yeah, they are working, they are contracting the diaphragm, everything is fine. But do you think the voluntary respiration can happen? No, voluntary respiration is not going to happen because here is a cut. So, right. So, whenever there is a lesion above the pons, there is going to be loss of voluntary respiration. Okay. Now, what if there is a lesion below medulla? Okay, below medulla. Okay. So, whenever there is a lesion below the medulla, look carefully, guys. Here there is a cut. Here there is a cut. Now, whenever there is a cut over here, the voluntary centers and these involuntary centers, do you think with the help of phrenic nerve they can control the diaphragm? No, here there is a cut. So, all the voluntary centers and these involuntary centers, they can no longer control the phrenic nerve. They can no longer control the contraction of the diaphragm. So, the inspiration is going to stop and the person is going to die for sure without any doubt. Okay. So, right, whenever there is a lesion below the medulla, okay, so this inspiration is going to stops. Inspiration stops and the person is going to die for sure. So, these are the things which I want you to know. Finally, what I am trying to say, there are certain voluntary centers and involuntary centers. Involuntary centers are more important for your exam. What are the where involuntary centers are present? They are present in pons and medulla. How many Pontine centers? 2 Pontine centers. How many medullary centers? 3 medullary centers. What are the Pontine centers? Pneumotaxic center, apneustic center. Medullary centers, DRG, VRG, pre-Borsinger complex. Who is the pacemaker? Pre-Borsinger complex. Who controls the rate? It's a pneumotaxic center. Who is an accelerator? Apneustic center. Who stops the inspiration? Vagus and pneumotaxic center. Who prolongs it? Apneustic center. Okay. So these are all the important points. Above Pontine lesions, loss of voluntary respiration. Below medulla lesion, inspiration stop. When you will see the apneosis, it's a damage to both the pneumotaxic center as well as vagus. How apneosis resemble like breath holding. Okay. So with this, the topic of regulation of respiration is completed. Hope the video is helpful. Thank you.